Digital Guide to the Dissection and Study of the Domestic Dog was created as a combination anatomy textbook, atlas, and dissection guide. The guide has been split into separate text and picture guides to enhance its use among both veterinary students and practicing veterinarians. Picture and digital guides are purchased separately. Using the digital and picture guides in tandem is the most effective way to utilize this reference for veterinary students. Practicing veterinarians will find the guides useful, especially for reviewing the anatomical structures prior to performing clinical or surgical procedures. The section on osteology contains 8 pages of text describing the anatomy of the bones of the thoracic limb. Specific features of the scapula are revealed in this page of the guide. In Section 2, there are 49 pages of text describing how to dissect the cervical region and thorax, with detailed descriptions of muscles, tendons, ligaments, arteries, veins, nerves, lymph nodes and lymphatic ducts, thoracic and pleural cavities, mediastinum, viscera of the thoracic cavity, including autonomic nervous system structures, the thymus, heart, trachea, lungs, esophagus, and pleura. Cervical fascia and muscles of the ventrolateral neck, such as the sternocephalicus, sternohyoideus, and sternothyroideus, are discussed in this portion of the text. Here we discuss the external abdominal oblique muscle. Instructions for removing a rectangular portion of the lateral thoracic wall are described here. Parietal pleura, mediastinum, and thymus are described on this page. Structures of the interior of the right ventricle are elucidated within these steps. Surface grooves of the heart, the periconal, interventricular, and coronary are explained on this page. The esophagus, trachea, and nodes of the bronchial lymphocenter are discussed on this page of the guide. The vagosympathetic trunk and vagus nerves are discussed here. In Part 3, there are 31 pages of text describing how to dissect the abdomen, with detailed descriptions of muscle, tendons, viscera, blood vessels, nerves, peritoneum, lymph nodes, and lymphatic vessels. On this page, we have a review of the external abdominal oblique muscle. A discussion of the liver and gallbladder ensues on this page of the text. The lesser omentum, stomach, and gastric lymph node is reviewed in this portion of the guide. Celiac and phrenico-abdominal arteries are discussed in these steps. The ileocholic artery and its branches are reviewed here.